My name's Stuart. I was diagnosed with testicular cancer last year. Following my treatment and operation, I had chemotherapy. Following that, I ended up with neutropenic sepsis. I had no idea what neutropenic sepsis was before. I didn't even know what sepsis was.
Neutropenic sepsis is a medical term for a very severe infection. This is one of the complications of chemotherapy. People, if they are not informed about this, may become unwell rather rapidly, and if they don't get to hospital early, if they don't get antibiotics on time, they can even die. Neutropenia refers to a low white cell count, and there are many types of white cells in blood. And the most common white cells are neutrophils, and their role is to fight infections, particularly bacteria, and also fungal infections. And after chemotherapy, not enough white cells are produced, so our white cell count in blood is low. This means that patients get prone to infections. In this situation, with a low white cell count, infection can develop very quickly and within hours lead to neutropenic sepsis, which is a very severe form of infection.
When patients are suffering from neutropenic sepsis, they can feel quite unwell, and they can feel quite unwell quite quickly. Very often patients will complain of feeling very cold or shivery. Sometimes patients will complain of other symptoms such as a sore throat, a runny nose, perhaps some diarrhoea, a cough, occasionally passing urine more frequently.
Within the 10 days I was absolutely fine, no issues whatsoever. And then it's about day 13, day 14, temperature spiked, started feeling unwell.
Patients will always be advised to contact their hospital immediately if they have a temperature or if they feel unwell.
The consultant gave me a card following the chemotherapy with my treatment on it. They said if you've got any symptoms within 10 days or so, she should phone a consultant or return back to your nearest A&E.
We try always to warn people about the earliest signs of it. So all patients that undergo chemotherapy should be used to measure their temperature several times per day, and particularly when they feel unwell.
Very strange. To me, I felt like I had a cold, just a normal shivery cold. Just wanted to get warm. If I hadn't taken my temperature, don't know what would have happened.
When temperature gets above 37.5, they should not hesitate, and they should make their way to emergency admission as soon as possible.
As soon as a patient arrives, we would be taking blood samples to check their normal blood results, but also for signs of infection. It's particularly important if somebody is neutropenic not to delay treatment. The treatment for neutropenic sepsis is antibiotics, which are administered into a vein. Sometimes that's with a small needle into the hand or the arm, and sometimes it's into a slightly more complex line that a patient may already have in place. Very often patients who are at risk of neutropenic sepsis want to know what they can do to reduce the risk of infection. The advice is very simply to adhere to good hand hygiene, such as washing our hands when we go to the toilet, washing our hands after we've been stroking the cat or the dog, and washing our hands before we prepare food.
We recommend that people make sure that they eat very fresh food, that they wash everything, particularly vegetables. Dairy products are pasteurized or ultra-heated to avoid any food that could cause any food poisoning.
It doesn't make common sense to reduce the contact with other people, because if people have coughs and colds, then there's a higher chance that the patient will develop infection. And we would usually recommend that patients don't go to crowded places such as the theatre, the cinema, busy shopping centres.
Having a young family, I have to think about them, and now it's just changed the way I think about everything in life now. Try and keep myself healthy, try and keep myself active, and just trying to keep away from any kind of infections, etc.